Hello everyone, I'm Lavanya from PeacePal. Today I'm going to bring to your notice a very sensitive topic, children's mental health. But before starting with it, let's firstly talk about mental health. What is it? Mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. If you want to and are eager to learn more about it, you can find it in our previous videos. Coming back to mental health in children. Being mentally healthy in childhood means reaching development and emotional milestones and learning healthy social skills and how to cope when there are problems. Mental health is important throughout childhood from parental considerations through transitions to adulthood. For instance, there is an overweight boy who is teased about his weight in school, may withdraw socially and become depressed and reluctant to play with others or exercise, which further contributes to his poorer physical health and which further leads to poorer mental health. These issues have long term implications on the ability of children to fulfill their potential as well as consequences for the health, education, labor, and criminal justice systems of our society. Raising a child can be challenging. Even under the best circumstances, their behavior and emotions can change frequently and rapidly. All children are sad, anxious, irritable, or aggressive at times, or they occasionally find it difficult to sit still, pay attention, or interact with others. In most cases, there are just typical development phases. However, such behaviors may indicate a more serious problem in some children. It may be difficult to understand mental health disorders in children because normal childhood development is a process that involves change. Additionally, the symptoms and disorders may differ depending on a child's age, and children may not be able to explain what they are feeling or why they are behaving in a certain manner. It then becomes difficult for the parents to understand what their child is going through. Some other factors might also prevent parents from seeking care for a child who has a suspected mental illness. For example, parents might be concerned about the stigma associated with mental illness or the use of medications and the cause of logistical challenges or treatments. Mental disorders can begin in childhood and may continue till adulthood and beyond. Examples of mental disorders are as follows. Firstly, anxiety disorders. Anxiety disorders in children are persistent fears, worries, or anxiety that disrupt their abilities to participate in play, school, or typically age appropriate social situations. Diagnoses include social anxiety, generalized anxiety, and obsessive compulsive disorders. Next is attention deficit hyperactivity disorder, ADHD. Compared with most children of the same age, children with ADHD have difficulty with attention, impulsive behaviors, hyperactivity, or some combinations of these problems. Next is autism spectrum disorder. Autism spectrum disorder is a neurological condition that appears in early childhood, usually before the age of 3. Although the severity of ASD varies, a child with this disorder may have difficulty communicating and interacting with others. Next is depression and other mood disorders. Depression is persistent feeling of sadness and loss of interest that disrupt a child's ability to function in school and interact with others. Bipolar disorder results in extreme mood swings between depression and extreme emotional or behavioral highs that may be unguarded, risky, or unsafe. Next is eating disorders. Eating disorders are defined as a preoccupation with an ideal body type, disordered thinking about weight and weight loss, and unsafe eating and dieting habits. Eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder can result in emotional and social dysfunction and life threatening physical complications. We usually find it more common in youth these days. Post traumatic stress disorder, PTSD. PTSD is prolonged emotional distress, anxiety, distressing memories, nightmares, and disruption behaviors in response to violence, abuse, injury, or other traumatic events. Lastly, I would talk about schizophrenia. Schizophrenia is a disorder in perceptions and thoughts that cause a person to lose touch with reality, psychosis. Most often appearing in the late teens during the age of 20s, schizophrenia results in hallucinations, delusions, and disordered thinkings and behavior. Without treatment, these mental health conditions can prevent children from reaching their full potentials. Many adults who seek mental health treatment reflect on the impact of mental disorders on their childhood and wish they had received help sooner. Warning signs that your child may have mental disorders include persistent sadness that lasts 2 weeks or more, withdrawing from or avoiding social interactions, hurting oneself or talking about hurting oneself, talking about death or suicide, outburst or extreme irritability, out of control behavior that can be harmful, drastic changes in moods, maybe the person is being too moody, changing in eating habits, loss of weight, difficulty in sleeping, frequent headaches or stomach aches, difficulty concentrating, change in academic performance, avoiding or missing school. Childhood mental disorders can be treated and managed. There are many treatment options based on the best and most current medical evidence. Parents and doctors should work closely with everyone involved in the child's treatment teachers, coaches, therapists, and other family members as well. Taking advantage of all the resources available will help parents, health professionals, and educators guide the child towards success. Early diagnosis and appropriate services for children and their families can make a difference in the life of the children with mental disorder. Mental health is important to overall health. Mental disorders are chronic health conditions, conditions that last a long time and often don't go away completely, that can continue through the lifespan. Without early diagnosis, the treatment, child with mental disorders can have problems at home, in school, social gathering, forming friendships, interactions. Mental disorders can also interfere with child's healthy development, causing problems that can continue into adulthood. You should know that your child's mental health matters. Your mental health matters. You can check out our website peacepal.in for detailed information on such various topics, alternate videos, and daily blog posts. And you can check out our store section for various courses and packages, appointments with therapists, and self help books. Because together we can make a difference.